Bismillah ar-Rahman ar-Rahim. Assalamu alaikum everybody. Welcome again to my channel. Today, inshallah, we will talk about one group of drugs, the discovery of which made surgery possible with less pain and suffering. I'm talking about the general anesthetics. As you will see, general anesthetics are classified into two groups. One of them is inhalation general anesthetics. Inhalation general anesthetics, we'll talk about them in this presentation and as well in the next presentation. So what are the main goals of this presentation? First, we have to know what are the different types of anesthetics used medically. Then we have to know what are the mechanisms involved in the actions of this general anesthetic. Then we have to speak about stages of general anesthesia and how these stages are affected by different factors. We'll talk about the properties of an ideal general anesthetic, and that's why we have to use different drugs before and after the induction of surgical anesthesia. So these are the main objectives of this presentation. Somebody might ask, what does it mean, anesthesia? Anesthesia actually, it is an old Greek word which means loss of pain sensation. Loss of pain sensation. We have to differentiate between analgesia and anesthesia. Analgesia is a different thing, as we will discuss later when we talk about analgesics. But anesthetics, they are different. So they might produce loss of pain sensation. If this loss of pain sensation is not accompanied by loss of consciousness, i.e. the consciousness is intact, in this case they are known as local anesthetics, as you will see later. So local anesthetics are drugs which produce loss of pain sensation without loss of consciousness, i.e. the consciousness will remain intact. المخدرات الموضعية الconsciousness معناها الوعي، فقدان الوعي. Consciousness is intact. The second group, they are known as general anesthetics. General anesthetics. These drugs, they produce general anesthesia. Usually, in this case, these drugs, they produce loss of pain sensation plus loss of consciousness, okay? So there is loss of pain sensation and loss of consciousness. The general anesthetics, they are divided according to their nature into two main groups. The first is known as inhalation anesthetics, inhalation anesthetics or inhalation anesthesia. Inhalation anesthesia. From its name, these drugs, they are given through the respiratory tract. Another group are the intravenous anesthetics or intravenous anesthesia, and these usually they are given through the vein. Today's presentation will talk about the inhalation anesthesia, inhalation anesthetics. Drugs which produce inhalation anesthesia, they either belong to a volatile liquid anesthetics, where they are present as a volatile liquid at room temperature, or they might be gases. It might be a gas like nitrous oxide, the most famous nitrous oxide, okay? So in this presentation, we are talking about inhalation anesthetics. So inhalation anesthetics, especially volatile liquid anesthetics, which we'll talk about them in this lecture. Volatile liquid anesthetics, as I have said, they are present at room temperature as volatile liquid, as you can see. They are liquid in nature at room temperature. Usually, they are given through a specific anesthetic delivery machine, through a face mask or laryngeal mask, or through a tracheal tube. This is an example of the machine which is used to induce general anesthesia by using volatile liquid anesthetics. Okay? So, how these drugs act? How they produce loss of consciousness? The exact mechanism is unknown till today, of course, but they have found a close relationship between potency of the general anesthetic and its lipid solubility. They found that the higher the lipid solubility, the higher the lipophilicity of the general anesthetic, the higher is the potency. That means lipophilicity as is indicator of potency. So they have suggested that the primary site of action of these drugs is the lipid bilayer, the lipid bilayer of the plasma membrane. As you can see, this is the lipid bilayer of the plasma membrane of any biological membrane like which is present on the neuron, as we have talked about last week and last presentation. They have suggested that the general anesthetic they dissolve in the lipid bilayer of this membrane. By dissolving in this lipid bilayer, they will change either the activity of a cell membrane receptors, or they might change the activity of ion channels. The activity of ion channels. This suggestion has been proved experimentally, where they found that the general anesthetic they changed the function of ion channels, and they found that to be true with voltage gated sodium channels. Voltage gated sodium channels. As we have said several times, on the plasma membrane of any neuron, there is specific sodium channels which opens, they are closed when the neuron is inert, and once action potential arrives, they cause opening of these sodium channels. Sodium will rush in, causing depolarization. Depolarization means excitation. This activity is inhibited by the general anesthetic. This is one. A second site through which these drugs has been suggested to act is through the potassium channels. Membrane potassium channels. The same thing, potassium channels, they are present on the cell membrane, and as we know, potassium is concentrated inside in the cytoplasm. Once the potassium channels are opened, potassium will rush out of the cell from the cytoplasm to the exterior, and this rushing out of potassium will increase the negativity inside the membrane, and this will produce what's known as hyperpolarization. And as we have said many times, hyperpolarization means inhibition. Why? Because in this case, the neuronal membrane, it needs a stronger stimuli to produce action potential. So this is the first site of action of general anesthetic. They might change the function of certain ion channels. A second site, they have suggested they might act through changing the function of certain receptors. They found that the general anesthetics, they activate GABA A receptor, GABA aminobutyric acid type A receptor. These receptors, as we know, they are present on the plasma membrane, and they are linked to chloride channel. Once the GABA receptor is activated, chloride channel will open and chloride will rush in, because chloride is concentrated outside the cell. Once the GABA receptors are activated, the chloride channel will open and chloride will rush in. As chloride rushes in, it causes hyperpolarization of the membrane. That's mean inhibition. So this is the first receptor. The second receptor, where they suggested that the general anesthetic act on the glutamate receptor, especially the NMDA glutamate receptor. These are receptors usually they are stimulatory. They increase intracellular calcium. This action of the glutamate receptor are blocked by general anesthetic. This will result in decrease in neuronal activity, okay? A third side of action, they said that they increase in active forms of nicotinic receptors. So nicotinic receptors, as we know, in the brain, they are linked to sodium channels. Nicotinic receptors, they are linked to sodium channels. Recently, they said that the nicotinic receptor, they are present either as active or they are present as inactive state. Active or inactive state. The active state will permit the opening of sodium channel, i.e. excitability, as we know, because as we have said, opening of sodium channels, sodium will rush into the cell, and this will cause depolarization. As well, in inactive form of the nicotinic receptor, they don't open the sodium channels, and therefore they don't produce depolarization. They found that the general anesthetic, they increase the inactive form ratio. معناها البرسنتج of inactive form will be more. In this case معناها no more depolarization. معناها ايش؟ inhibition. It means inhibition. Correct? Okay? يبدأ these only suggestions that general anesthetic might act by dissolving the lipid bilayer, and this will produce change in ion function activity, and we have taken example of that, or they might produce change in the receptor function, and they have found certain proofs of involvement of different receptor. Okay, so this is the first. The most recent theory, now اللي suggested maybe only few years ago, that general anesthetics, they act through the lipid rafts. Okay, lipid rafts, what they are? The lipid rafts, they are plasma membrane. The lipid rafts, they are plasma membrane microdomains. This is the lipid raft. It consists of cholesterol. The yellow is cholesterol, and the orange is the glycolipids. The lipid rafts, they are present on the cell membrane. They are floating freely on the cell membrane. They are formed from cholesterol and glycolipids. These lipid rafts, now it has been proved that they have many physiological function and pathological function. They are involved in pathology, in certain disease, and also they have important physiological function. Some of I will not talk about all of them, of course, it is not our field, but physiologically, these lipid rafts, they said they control, for example, membrane fluidity of the membrane, and as well they control trafficking of membrane proteins. Like ion channels, they are membrane proteins, as we know, like receptors, ion channels, or receptors trafficking in and out of the membrane into the cytoplasm. They said that they are controlled by lipid rafts. Lipid rafts as well, they said that they are involved in many pathological conditions like cancer. They found that certain type of cancer, lipid rafts, they are present in higher concentration. Also, they are involved in certain types of inflammation. Okay? What I want to say now, just to mention that, they have said that the general anesthetic, they produce their action through the lipid rafts. For example, the opening of potassium channel, which we have talked about, is done through the lipid rafts. How it is done, طبعا, it is a long story. I am not going to mention it. المهم, I have to know now, maybe in a few years' time, this will be much clearer. The lipid rafts rule will be much clearer. Okay? Now, so these are the mechanisms by which general anesthetics might act. They produce reversible loss of consciousness. Why? Because as we have said, they dissolve in the lipid bilayer. By dissolving in the lipid bilayer, they might change the function of certain receptors, and we have given examples, or they might change the function of certain ions, and we have given examples. More recently, as I have said, they said that they might be involved, the action is done through the lipid rafts on the biological membrane. Okay, so this is first the mechanisms by which these drugs act. So these drugs, they produce the reversible loss of consciousness by acting by depression of the central nervous system. The question now is the central nervous system is sensitive to the same degree? All parts of the central nervous system is sensitive to the same degree to the general anesthetic? No, not of course. It is not. Because if it is sensitive to the same degree, that means once you take the general anesthetic immediately, it will depress the medulla and this will result in immediate death. ولكن this is not the story. والله سبحانه وتعالى الخالق هو اللي جعل الفرق هذا في sensitivity. So what will happen? As we will see inshallah, there is a difference in the sensitivity of different parts of CNS to the general anesthetic. Some are more sensitive, some parts of the central nervous system is more sensitive than other parts to the effect of general anesthetic. So what will happen in this case? The first part, which is the most sensitive to the general anesthetic, is the substantia gelatinosa. The substantia gelatinosa. Substantia gelatinosa. This substantia gelatinosa, as you know, it is present in the spinal cord, in the anterior horn of the spinal cord, and in the substantia gelatinosa here, its function is to transfer all sensory input from the periphery to the central nervous system, to the sensory area in the cortex. So therefore, if we cut this transfer of information here, what do you think will happen? No pain will be transferred to the higher cortical area. This will result in analgesia. Okay? So the first most sensitive part to the general anesthetic is the substantia gelatinosa. المادة الهلامية. substantia معناها المادة وجيلاتينوزا الهلامية. substantia gelatinosa. So substantia gelatinosa is the most sensitive to the general anesthetic, producing analgesia. And next, more sensitive to general anesthetic is the cortical area. As we have talked last week. The cortical area, اللي هي outer layer of the cerebral hemispheres, which we talked about in our last presentation. This cortical area, as you know, there are neurotransmitters, as we have said. Some of them, they are excitatory, some of them are inhibitory, and they work in balance. So the person is normal because there is a balance between excitatory neurotransmitters and inhibitory neurotransmitters. Allah subhanahu wa ta'ala خلق لنا inhibitory neurotransmitters that are inhibited first by general anesthetic. واحد أول ما ياخذ المخدر الموضعي المخدر العام أول حاجة يصير لها inhibition اللي هو inhibitory mechanism. هذه يسموها disinhibition. This is known as disinhibition. يبدأ يعمل inhibition للinhibitory mechanism first. يسموها disinhibition. طبعا disinhibition, what will be left? The excitatory mechanism. The excitatory mechanism will produce excitation. Producing excitation. So initial effect is excitation. Initial effect واحد يقول لك, واحد might ask you, the initial effect of general anesthetic on the cortical area is excitation. Why? Because the general anesthetic first, they inhibit the inhibitory mechanisms. This is known as disinhibition. So producing excitation. This is the beginning. بعدين after that يحصل inhibition of all activity, excitatory and inhibitory. لما inhibition of all activity يسموها general inhibition. يسموها general inhibition. Okay. يبدأ on the cortical area there are two mechanisms: inhibitory neurotransmitters and excitatory neurotransmitter. Which is more sensitive? Inhibitory. يبدأ inhibitory will be inhibited first. This will produce disinhibition, i.e. excitation. بعدين later both will be inhibited, inhibitory mechanisms and excitatory mechanisms, and this will result in general inhibition. Okay? Now, a third part which is most sensitive to the general anesthetic is subcortical area. structures اللي تكلمنا عليها في السبكورتيكال اريا، الثالاموس والهايبوثالاموس وكل الكلام هذا، والascending reticular activating system. And we have said the reticular activating system will activate the cortex and will produce consciousness or awareness. صح? Okay. Now, so on this cortical area is the third sensitive part. It will be inhibited. So what will happen by inhibition of reticular activating system? يحصل loss of consciousness، فقدان الوعي، loss of consciousness. شوفوا رحمة ربي ابتدت بمراحل. الأولى عبر العمود الفقري، وبعدين طلعت للcortical area، وبعدين للsubcortical area. The last sensitive part is the medulla. The last sensitive part is the medulla. This will result in medullary inhibition. As we know, in the medulla contains the vasomotor center, or cardiac center, and the respiratory center. So in this case, if these centers are inhibited, what will happen? Death, of course. موت حتمي. فبالتالي this is the last stage. This is the last sensitive area to the general anesthetic. وهذه رحمة من ربي. لو إن هذه كانت most sensitive، معناها البيرسون أول ما يعطوه الجنرال anesthetic على طول يموت، ما يخش حتى في loss of consciousness. لأن if these vital centers are depressed, a person will die immediately. Okay? As we can see, you have the sensitivity of the general central nervous system to the general anesthesia is different, and this produced what are known as stages. So now we are going to talk about stages of anesthesia. Stages of anesthesia. These stages of anesthesia were classified according to the sensitivity of the central nervous system. They classified them into 4 stages. Stage 1, which is known as stage of analgesia, as we have said, and usually stage 1 starts from the time of administration of the general anesthetic to the loss of consciousness. So this is known as stage 1. At the beginning of stage 1, there is analgesia with no amnesia. يعني the person does not forget what's happening to him. So there is analgesia, تسكين, with no amnesia. مش فيش فقدان للذاكرة. ولكن it ends up at the end of stage 1, there is analgesia with amnesia. The person will forget all what happens to him. Amnesia. Okay? This is stage 1. Once stage 1 is finished, it will enter into stage 2, which we call the stage of excitement. And we said why? Because why this happens, as we have said, because there is disinhibition, removal of inhibitory mechanisms, which will result in excitement. It starts from the loss of consciousness with excitements like delirium, الهلوسة, like uncontrolled movement, like irregular breathing, like hypertension and tachycardia. This is signs of excitement. طبعا this is not usually wanted in a general anesthetic. We don't want the patient to enter into delirium. We don't want him to do uncontrolled movement he doesn't know about, and we don't want his breathing to be irregular or his blood pressure to be increased or his heart rate to be increased. Yep, this is stage 2. Usually it is undesirable, okay? Now, many people, they call stage 1 as induction phase. Induction phase. Sorry for the handwriting because I'm using tablet. Induction phase. Okay? So some of people, they call stage 1 and stage 2 as induction phase. Induction معناها تحريض. Why they call them induction? Because they induce the third stage, which is the wanted stage. Stage 3, stage of surgical anesthesia. In this stage, of course, the patient will lose consciousness completely, and there will be removal of excitement. معناها the person will become calm. There is no eye movement, and the breathing will return to normal with slight respiratory depression and muscle relaxation. Usually, surgery, it is done in the third stage of the surgical anesthesia, especially the deep surgery, okay? Now, this stage 3 is divided according to its depth into 4 planes. Plane 1, plane 2, plane 3, and plane 4. Each of these planes, they have their own signs. I will not talk about the signs of each plane. المهم ان plane 4, what we should remember, plane 4 should never be reached. Why? Because immediately after plane 4, the patient will enter into stage 4. With stage 4, as we have said, it is medullary paralysis. والمظلة, as we have said, it contains the vital centers. فيحصل paralysis of all vital function, وبالتالي يحصل paralysis للrespiration, respiratory arrest, cardiac arrest, vasomotor collapse, and severe hypotension. Of course, these should never be reached in general anesthesia, should be avoided. And once it is reached, for example, for any reason, it should be reversed immediately. If not reversed, the person might die, okay? So these are 4 stages of anesthesia, which are very famous stages of anesthesia. First with second, some people, they call them induction phase. Stage 3, stage of surgical anesthesia, and stage 4, the death stage or medullary paralysis. So an ideal anesthetic, when we talk an ideal anesthetic, it should produce fast induction. تحريض سريع. لأن we don't want stage 1 or stage 2. ولا, we better enter immediately into stage 3. And stage 3 should be maintained for a long time. Long maintenance of stage 3. We want stage 3 to be to stay for a long time to allow for the surgery we needed, okay? And after finishing the surgery, the recovery should be fast as well. Recovery of the patient from general anesthesia should be fast. معناها regaining of conscious should be fast. The ideal anesthetic should produce fast induction, should produce long maintenance, and should produce fast emergence. Okay? Now, so what are the factors which will control induction phase? There are certain factors which will control induction phase. There are many factors, like I will talk only about 2 factors. So what are the factors which will affect the induction of general anesthesia? The first and most important factor is what's known as blood solubility. The solubility of the general anesthetic in the blood. The higher the solubility of the blood, the higher the solubility of the general anesthetic in the blood, the longer will be the induction, and we will understand why. So blood solubility, the higher the blood solubility, the longer is the induction. Induction will be long. We will know why in a minute, okay? Okay? This blood solubility is known as blood gas partition coefficient. Blood gas partition coefficient. That means that solubility of the anesthetic in blood divided by solubility in gas, this is known as partition coefficient, okay? The partition coefficient, it is a number, there is no definition of it, okay? Okay? Now, so what will happen? Just let us take an example. Let us take an example of anesthetic with high blood solubility. So this is the lung where we administer the general anesthetic, and it will go from the lung, from the alveoli into the blood, and from blood to the brain to produce loss of consciousness. Suppose that the anesthetic is highly soluble in the blood. So what will happen? Once we give the anesthetic, it will dissolve in the blood, and it will still dissolve in the blood. More will dissolve in the blood till the point where the blood is fully saturated with the anesthetic. Till the point where the blood will be fully saturated with the general anesthetic. At this moment, the general anesthetic will enter the brain and produce loss of consciousness, okay? Now, so in this case, if the drug is highly soluble in the blood, the rise of partial pressure, الضغط الجزئي متاعها في البلد, the rise of blood pressure will be slow. معناها it will take a longer time to reach the brain. Take a longer time before it can enter the brain. وعرف يبدأ الانduction phase هيكون short ولا long؟ هيكون long. Okay? فالinduction phase, the length of the induction phase will depend on the blood solubility. The higher the blood solubility, the longer is the induction. واضح الكلام؟ Okay? So I repeat it again. So in case of highly blood soluble general anesthetic, so what will happen? The rise of partial pressure will be slow. The rise of partial pressure would be slow till full saturation of the blood with the general anesthetic. In that moment, the general anesthetic will enter the brain producing loss of consciousness. معنى الinduction phase هيكون long. Okay? But let us take another example of a drug which is poorly soluble in the blood. A drug which is poorly soluble in blood. It has low blood solubility. So in this case, the drug will dissolve in the blood and will reach the maximum partial pressure in the blood fast to the point that it can be transferred to the brain fast. Okay? So because it doesn't like the blood, معناها saturation in the blood will be reached fast. A rise of blood pressure, the rise of partial pressure will be fast, that it will enter the brain faster. So for general anesthetic with low blood solubility, the induction will be short. The induction phase will be short, okay? So let us take an example, for example. Let us take an example for مثلا methoxyflurane. methoxyflurane, for example. Methoxyflurane, الBG blood gas partition coefficient is about 10 تقريبا حوالي 10. معناها it is highly soluble in the blood. Let us take another example, for example halothane. I'm not sure about the numbers, لكن at least it is an example. الهالوثين blood gas partition coefficient about 2, okay? Only 2. That means methoxyflurane is highly soluble in the blood. In this case, an induction phase will be longer. صح? Because if it is highly soluble, solubility in the blood is higher than its solubility in gas. In this case, induction will be long. And vice versa. If the solubility is low in blood, that means the induction will be fast. Therefore, the first, we have to remember, blood gas partition coefficient will indicate the induction phase, whether the anesthetic will produce fast induction or it will produce slow induction. This is first. The second factor, most important, is the potency of the general anesthetic. طبعا, as the potency increases, معناها we need smaller dose of the general anesthetic. Well, this is important. We don't want to use larger concentration. We want to use a smaller concentration of the general anesthetic in the respiratory air. In this case, this is expressed by the minimum alveolar concentration. Minimum alveolar concentration, or MAC value. We have always to remember a MAC value. What does it mean, MAC value? What does it mean? شنو تعني MAC value? It means that the minimum is the concentration of the anesthetic in the air in which 50% of the patient will not respond to painful stimuli. يبدأ هو التركيز اللي موجود في الرئة اللي عنده 50% من المرضى لا يستجيبوا لألم. لا يستجيبوا لألم. Okay? Now, يبدأ minimum alveolar concentration is divided as the minimum alveolar concentration of inhaled anesthetic at which 50% of the people do not move in response to noxious stimuli. Noxious معناها painful stimuli. Painful stimuli. يعني they will not respond to pain. They will not respond to pain. ففي الحالة هذه we expect that the higher the potency, the lower the MAC value. So let us take an example. مثلا drug A MAC value equals 2. Drug B MAC value equals 0.1. Which is more potent, drug A or drug B? Drug B, of course, it is more potent because the lower the MAC value, the higher is the potency. The lower the MAC value, معناها we need the lower concentration of the drug to produce loss of consciousness. في الحالة هذه we need lower amount. مادام lower amount معناها it is more potent than drug A. Drug A we need 2 مثلا percent, while drug B we need only 1%, 0.1%. فبالتالي we expect that drug B is more potent than drug A. Okay? واضح? Okay? So these are the factors that will affect the induction of general. So we would expect that a general anesthetic should have a certain property. Okay? So what are the properties of an ideal general anesthetic? What are the properties of an ideal general anesthetic؟ من كلام اللي قلناه شنو هو أهم خصائص أفضل مبنج عام؟ أهم خصائص شنو هي؟ أول حاجة إنه should produce fast induction, as we have said إن induction should be fast induction. لأن كنا the longer the induction, the more the excitement اللي we don't want. Okay? يبدأ fast induction is a good property of anesthetic. The second, it should have high potency. ليش high potency? So that we don't have to use large volumes. We can use smaller volumes of the general anesthetic to produce loss of consciousness. الثالث إن once إن the person loses consciousness, anesthetic should produce good muscle relaxation to allow for surgery. لأن زي ما نعرف في العمليات الجراحية especially متاع الابدومين والتوراكس والlower limbs, we need good muscle relaxation to allow for surgical anesthesia. Okay? Then the anesthetic should have a large therapeutic index. What does it mean? large therapeutic index معناها it will give us a wide margin between the and the third. So as we have said, the therapeutic index is the difference or the dose, the difference between the dose that produce therapeutic effect and toxic effect. So this should be large so that we don't enter into the toxic effect in this case, which is a medullary paralysis. We don't want a medullary paralysis to take place, okay? So in this case, the therapeutic index should be large. Once the patient loses consciousness, I can change the depth of anesthesia easily without being afraid that the patient might enter into medullary paralysis, okay? So this is the fourth property of an ideal general anesthetic. Next will be fast recovery. We would expect that once the surgery is finished, we stop the general anesthetic administration and recovery will take place fast, without excitement, without pain, without أي حاجة. For fast recovery, this is a requirement, and the patient will recover comfort, will not recover in hallucination or in vomiting or nausea, whatever. Okay? Last, in after recovery, there should be a good analgesia, تسكين جيد, لأن after recovery the patient will, if he recovers in pain, it will be a problem. So to have a good analgesia after recovery is a good property as well. Okay? So these are the ideal general. We said ideal معناها because there is no ideal general anesthetic. There is no one drug that can produce fast induction, can have high potency, can produce good muscle relaxation, can have a large therapeutic index, etc. There is no one drug. So what they do, they use a mixture of drugs. They use a mixture of drugs, mixture of drugs with the volatile general anesthetic. These, some people, they call it as balanced anesthesia. Balanced anesthesia. معناها drugs that are given before balanced anesthesia. Balanced anesthesia. معناها drugs that are given balanced anesthesia. معناها in this case, drugs that are given either before the induction of general anesthesia, during the induction of general anesthesia, or after recovery from general anesthesia. This is known as adjuvants to general anesthetics. Adjuvants to general anesthesia. Adjuvants, drugs which are given together with general anesthetics. So what are these adjuvants? Some of them, they are given before the induction of the surgical anesthesia. This is known as pre-anesthetic medication. Pre-anesthetic medication. Pre-anesthetic medication. So what are the pre-anesthetic medication? They usually, the night before the operation, if the person is suffering from anxiety, طبعا واحد خشن عملية, what do you expect? He will suffer from insomnia. In this case, he might be given a single dose of diazepam or a barbiturate. ما يختلفش. Usually it is a diazepam, a single dose of diazepam to give him a good night's sleep, if it is necessary, of course. Second group of drugs which are used as pre-anesthetic medication are the opioid analgesics. Opioid analgesics اللي هم morphine-like drugs. Morphine-like drugs. They are opioid analgesics. Why they are given opioid analgesics? Why? سبب. ليش هم ينعطوا الopioid analgesics؟ لسببين مهمين. أول حاجة to reduce the amount of general anesthetic needed. To reduce the amount of general anesthetic needed. لأن themselves opioids themselves they are CNS depressant. They depress the central nervous system. فبالتالي هنحتاج لكمية أقل من general anesthesia from the general anesthetic to produce loss of consciousness. This is very important. If the opioids, they can reduce the amount of general anesthetic needed to induce loss of consciousness. Plus in an opioid, they will provide analgesia after recovery. They will provide analgesia after recovery. بعد الإنسان ما يصحى من العملية هيصحى في سكون، ما يصحاش في ألم. Okay, why? لأن الأوبيوز will provide very strong analgesia. زي شنو الأوبيوز اللي use commonly؟ المورفين، هذه الجرعة 10 to 15 ملغ intramuscular. بيتيدين as well 50 to 100 ملغ intramuscular وهكذا. Okay, يبدأ we have to know إن الأوبيوid like drugs that are used pre-anesthetic medication immediately before the induction of anesthesia for two reasons: to reduce the dose needed of the general anesthetic, and as well to produce analgesia after recovery. Third, most recent and most famous drug is dexmedetomidine. Dexmedetomidine. This is a new alpha-2 adrenergic receptor agonist. It has many advantages. The most important, it produces sedation before surgery. It produces analgesia after recovery. It reduces anxiety. It is anxiolysis, يعني it reduces anxiety. It also decreases sympathetic activity and stabilize the cardiovascular effect. The most important, they reduce the anesthetic requirement. كل هذه very good advantages. For the dexmedetomidine. Dexmedetomidine is a new drug, alpha-2 adrenergic receptor agonist. So why it is very effective? Because it can reduce the amount of anesthetic required, because itself it produces sedation, can produce analgesia, anxiolysis, يعني decrease anxiety, وكذلك stabilize the cardiovascular system, okay, without depression of respiratory function. This is very good pre-anesthetic medication. Second, which is commonly used, is atropine. Atropine in a dose of atropine, it is anticholinergic. It is muscarinic antagonist. It blocks the muscarinic receptors. It is anti-muscarinic drugs, as we have taken it before. It is given in a dose of 600 microgram intramuscular, usually it is given for two important reasons. الأول إن prevent secretion in the respiratory tract. This will produce a dryness of bronchial secretion, which will prevent laryngospasm, what's known as laryngospasm. في larynx, spasm of the larynx. So what will happen if there is a lot of salivation in the larynx, a lot of salivation which goes down into the larynx? It might cause laryngospasm during surgery, which is not wanted. This is not wanted. So what we give? We give atropine. It prevents salivation, produces dryness of secretion. It blocks the muscarinic receptor in salivary gland. It produces dryness of secretion, and therefore it will prevent laryngospasm during surgery. This is one. Second, it blocks the vagal nerve. والvagal nerve زي ما نعرفه, it is the parasympathetic supply to the heart. During surgery, the vagal nerve might be stimulated, and if the vagal nerve is stimulated, it will depress the cardiac activity. فالاتروبين will prevent the effect of anesthetic on the vagal nerve, فبالتالي ما يحصلش depression of cardiac activity. Okay, so يبدأ الاتروبين. These are the main use of atropine to decrease secretion in the respiratory tract, to prevent laryngospasm, and as well to inhibit the vagal nerve, so that we inhibit the cardiac depressant effect of the general anesthetic. Lastly, are antiemetics like promethazine, which is a phenothiazine. It blocks the CTZ in the emetic center. Also cyclizine, which is H1 blocker. These drugs that are used to prevent nausea or vomiting after recovery from anesthesia. nausea or vomiting, usually they happen after recovery from general anesthesia. So in this case, they give these antiemetics during the induction of general anesthesia so that the patient will wake up with no nausea and vomiting. Of course, there are other many groups of drugs which are used as pre-anesthetic medication. It depends on the condition of the patient, on the health condition of the patient. Some people, they have chronic disease involving the liver or the kidney or the heart, so they might need other drugs other than these. Like, and these are the generally which are used common use for most of the patient. Okay. The second group of drugs, they are drugs which are used during surgical anesthesia. During surgical anesthesia خلال التبنيج العام خلال عملية جراحية. What we need during surgical anesthesia? What we need? We need muscle relaxation. We need muscle relaxation. So in this case, we use neuromuscular blockers. We use neuromuscular blockers. Okay. Neuromuscular blockers, they produce blocking of the skeletal muscle. Therefore, they produce relaxation of the skeletal muscle. They are used for two reasons or three reasons. First, they reduce the dose of general anesthetic needed to produce surgery. Then if I use a large dose of the general anesthetic, I might enter into stage 4, which I don't want. I want to make the surgery at the early stages at early planes of stage 3. Okay? So in this case, I add the neuromuscular blocker, which will produce muscle relaxation, and therefore I don't have to use a large dose of the general anesthetic. So this is the first goal of using neuromuscular blockers. They will reduce the dose of general anesthetic. Of course, as they will relax large skeletal muscles in the body, in the abdomen and thorax. وكذلك it will ease endotracheal intubation. It will ease when we want to induce a tube into the trachea. It will be much easier. Okay. There are two groups of neuromuscular blockers. The first, they are known as depolarizing neuromuscular blocker. They are known as succinylcholine like drugs. Depolarizing. وسميناهم depolarizing ليش? Why? Because they act as a partial agonist at the nicotinic receptor, as we have explained several times, at the motor nerve ending, which ends up into the muscle. The muscle, it has the nicotinic receptor. If we just imagine this is the muscle, it has nicotinic receptor, and this is the motor nerve which releases acetylcholine. We said before, acetylcholine, once it is released, it will act on nicotinic receptor, which will lead to opening of sodium channel, depolarization of the motor end plate, and release of calcium from the endoplasmic reticulum, and this will result in contraction of the muscle. هذه سميناهم depolarizing neuromuscular blockers. Why? Because they act as an agonist at nicotinic receptor. They enter the nicotinic receptor, they stimulate them, they produce initial stimulation. Initial stimulation means initial contraction. Then they don't leave the receptor. They produce what is known as sustained depolarization. Sustained depolarization. Sustained depolarization means block. I have explained that before in a previous presentation when we talked about drugs of neuromuscular blockers. Okay. Now, so these drugs, they produce initial contraction followed by paralysis, like ish, like a succinylcholine. Yet the succinylcholine, it acts as a partial agonist at the nicotinic receptor. It is a choline ester, succinylcholine. It is a choline ester. If it is a choline ester, that means it is metabolized quickly by plasma choline esterases. We have explained that before. Plasma choline esterases. فبالتالي it will have a short duration of action. It is metabolized by plasma choline esterases. Therefore, it will have a very short duration of action, only minutes. it will act for minutes. So therefore, they are used for certain surgical procedures. For example, they are used in tracheal intubation، معناها إدخال أنبوبة في التراكية، tracheal intubation. وكذلك they are used during surgery في ال ENT because in ENT they want to produce fast muscle relaxation of certain muscles, small muscles. فالساكسينايلكولين will produce relaxation for a short period of time. وكذلك they are used in emergency في حالة مثلا refractory laryngospasm. في بعض الحالات when they remove the tube from the larynx يحصل collapse in the larynx، يحصل laryngospasm. طبعا this is dangerous. So what they do they give succinylcholine to reverse this laryngospasm. المهم نعرف ان succinylcholine is used in short procedures, surgical procedures which requires muscle relaxation. Now, second group, they are known as non-depolarizing neuromuscular blockers. Non-depolarizing neuromuscular blockers. These are competitive antagonists. The competitive. What does it mean competitive? As we said before, they block nicotinic receptors at the neuromuscular junction. They enter the nicotinic receptor and they block them and they prevent the access of acetylcholine to this receptor. They are known as competitive neuromuscular blockers. And very famous examples like they are all these new drugs, but they are derivatives of the old D-tubercularine. They are curer drugs. وعندنا مثلا فيكيورونيوم، بانكيورونيوم، أتراكيوريوم وهكذا. There are many drugs which are available clinically to be used as neuromuscular blockers. يبدأ these drugs they are used for short and long surgical procedure. يبدأ they are used في endotracheal intubation for primary to improve intubation outcomes to facilitate airway management. يبدأ they are used في endotracheal intubation. وكذلك they are used during surgical procedure to produce relaxation of the large skeletal muscle. وكذلك they are used in case of some patient they put them on artificial respiration or mechanical ventilation زي ما يحصل في people who got COVID or corona. Usually they give them neuromuscular blocker like bankuronium or vicuronium. Why? Because they will relax the skeletal muscle of the thorax and this will help in mechanical ventilation اللي هو artificial respiration. Okay. يبدأ these are the most important drugs which are used during surgery. يبدأ during surgery what I need the neuromuscular blocker or muscle relaxation. Why? To reduce the amount of general anesthetic needed. Okay, so we can use either of group. If the procedure is short, I can use succinylcholine-like drugs. If the procedure is long, I can use D-tubercularine-like drugs. واضح الكلام؟ Okay. The third groups of drugs which are adjuvant to general anesthetic, they are given after recovery from general anesthesia. After recovery خلاص الواحد دار العملية وصحي منها. So the first thing what you expect he will need or she will need after recovery from general anesthesia. So the first thing the patient might need analgesic. He might need analgesics. The most commonly used non-steroidal anti-inflammatory drugs اللي هم الاسبرين لايك drugs، الباراسيتامول والاسبرين والمجموعة هذه، هايبوبروفين، aspirin like drugs, non-steroidal anti-inflammatory drugs. This is commonly used because these drugs they produce analgesia without affecting respiration. Sometimes if the pain is strong, we have to use morphine-like drugs like codeine ولا المورphine ولا الأوكسيكودون ولا البيتيدين. It depends on the severity of the pain. وفي الحالة هذه we have to be very cautious لأن usually the patient will recover with respiratory depression because of the general anesthetic. Morphine, of course, it is CNS depressant. It can depress the respiration further. So in this case, we have to be careful, very careful. The most commonly used is a mixture of the non-steroidal anti-inflammatory drugs and opioids. This is a good mixture because in this case I can use a lower dose of each and produce less toxic effects. Okay, a mixture of non-steroidal anti-inflammatory drugs and opioid. The most famous mixture is paracetamol and oxycodone or paracetamol plus codeine. Okay, this is the first thing I need after recovery from surgical anesthesia. I need analgesia, مسكن. Okay. The second drugs which are commonly used are anticholineesterases. This is a spelling mistake here. Sorry about that. Anticholineesterases. Anticholineesterases like neostigmine. This is usually used when we use competitive neuromuscular blockers. اللي هم ditibucurarine. Competitive neuromuscular blockers, these drugs, we said, they block a nicotinic receptor. فالacetylcholine released, it will find the nicotinic receptor already blocked. After recovery, sometimes these drugs, they are still present in the receptor. فبالتالي البيشنت will recover in apnea. معنى difficulty in respiration. انقطاع النفس. apnea due to relaxation of the costal muscles of the chest. فالapnea معناها the person will he cannot breathe spontaneously. يبدأ very difficult spontaneous respiration due to paralysis of the skeletal muscles of the chest. In this case, what we do, we give neostigmine. Neostigmine will prevent the metabolism of acetylcholine in the synapse. معناها levels of acetylcholine will be increased. Levels of acetylcholine in the synapse will be increased at the neuromuscular junction. They will replace the competitive neuromuscular blockers. We always said, as we said several times before, competitive معناها they compete on the same receptor, agonist or antagonist, which will take the receptor, the one which is present in higher concentration. Yet in this case, we give neostigmine. It will prevent the metabolism of acetylcholine. Acetylcholine level at the neuromuscular junction will be increased, replacing the competitive neuromuscular blockers from the receptor, recovering muscle activity. Okay, so this is why we use neostigmine to reverse apnea due to the non-depolarizing or competitive neuromuscular blocker. The neostigmine is used to reverse apnea after competitive neuromuscular blocker. ولكن neostigmine should never be used in case of depolarizing neuromuscular blockers. في حالة depolarizing neuromuscular blockers لو استعملت الساكسينالكولين after recovery the patient is still suffering from apnea, in this case what I should do, I leave the patient on artificial respiration لحد ما يحصل له spontaneous recovery. ليش؟ لأن if I give neostigmine, as we have said, depolarizing neuromuscular blockers, they are partial agonists. They produce blocking because they produce sustained depolarization. In this case, if I give them neostigmine, معناه neostigmine will increase الacetylcholine. معناها الacetylcholine will increase sustained depolarization, and this will produce more muscle paralysis, more muscle paralysis. Therefore, they are contraindicated. I should not give them in this case, okay? Somebody might ask you, why we give neostigmine to reverse apnea after competitive neuromuscular blockers, but not to the depolarizing neuromuscular blockers? Because, as I have said, neostigmine will increase the level of acetylcholine. In case of competitive, معناها acetylcholine will remove neuromuscular blockers from the receptor and they can reverse apnea. In case of depolarizing, they increase sustained depolarization, and with this will result in more muscle paralysis. I have explained that when we talked about neuromuscular blockers. I'll put the link to this lecture in the comments section, inshallah. Third group, which is commonly used, are the anticoagulants, either oral anticoagulants like warfarin, or the subcutaneous anticoagulants or intravenous like heparin. These drugs, they prevent coagulation bloods, especially after in old people, and these are used usually to prevent deep venous thrombosis, deep venous DVT, or deep venous, not intra, deep venous thrombosis, okay? This depends on the condition of the patient. There are other drugs which are used, of course, but I have spoken only about the most commonly used drugs after recovery from surgical anesthesia. This is what it is intended for this presentation. So, in summary, we classified the general anesthetics. We spoke about their mechanism of action, how the sensitivity in the CNS differs, and this will produce different stages of general anesthesia. We talked about different stages. For these stages, there are certain factors which will affect the induction of general anesthesia, and we talked about the drugs which are used with the general anesthetic to produce balanced anesthesia. Okay? So, at the end, I will say, Lillahi alhamdu min qabl wa min ba'd. I would like to thank you for your attention and hope to see you again in my next presentation, which will be about a comparison between different inhalation general anesthetic. I wish you a good health and prosperity. والسلام عليكم ورحمة الله وبركاته. شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.